South Australia's coronavirus cluster is growing, with more than 30 people now suspected of having the disease. There are 20 cases, but authorities believe another 14 people will return positive results. 5 new cases were confirmed today. Thousands of people again flooded clinics, resulting in more than 11,000 tests over the past 2 days. And tonight, more than 4,000 close contacts are in quarantine as authorities try to gain the upper hand on the Parafield cluster. Claire Campbell begins our coverage.
And we've been a prisoner here.
Desperate cries for help. Already in quarantine, guests are now told they'll have to start their fortnight of lockdown all over again.
They told me I was leaving in the morning yesterday morning. And I booked my car and they turn around and they say, no, you can't leave.
They're being moved because the Peppers Hotel is considered the source of Adelaide's coronavirus outbreak.
I wanted to meet my nephew today. I wanted to go for the job interview that I had lined up. I wanted to see friends that I haven't seen for years, and I ended up in the RAH because I was severely depressed.
I absolutely sympathise with them, particularly, they've been doing their 14 days and to be, told this. But we have to weigh that up with the risk of this disease getting out further in our community.
That's because 20 cases are now confirmed in the Parafield cluster. Another 4 today, with a 5th under investigation. 14 more are thought to have the virus, and there are many more in lockdown.
Around 4,000 people who are close contacts.
An order to isolate for anyone at the Elizabeth Aquadome last Saturday around lunchtime, or the Lyell McEwin Hospital's emergency department between Friday night and Saturday morning. One of the new cases today is a worker at a Brompton aged care home, where 3 staff are now infectious, but believed to have contracted the virus outside the centre.
All residents have been tested and all have been negative.
6 schools are also now impacted. 3 will close for a fortnight. Students were also sent home from Roma Mitchell College, and elsewhere asked to isolate after either a confirmed or suspected case. There are now more than 35 potential exposure sites across suburbs in Adelaide's north, west and south, prompting people in droves to get tested.
We are on track for more than 6,000. This is nothing short of sensational and will be a record for South Australia.
Queues spanned kilometres at testing sites, some turned away for a second day. This Aldinga clinic hit capacity after an hour, and people were told they wouldn't be tested today.
It's been almost 4 hours for us.
It's an amazing testament that people are actually coming out and getting tested.
There should be more testing stations around.
SA Health is working on it.
We're looking at bringing on substantial additional staffing. I would love to have 24-hour testing, but we've also got to think about the safety of people.
Safety first in a city trying to avoid a second wave. Claire Campbell, ABC News, Adelaide.
Authorities say testing of genetic material has identified the source of the virus, a returned traveller who went into hotel quarantine on November the 2nd. It took 5 days for the first case of transmission to be identified, a woman in her 80s. It's thought she caught the disease from her daughter, who worked at the hotel. Here's state political reporter Stacey Lee.
Hotel quarantine, the hardest edge of a hard border. And a hard surface in the Peppers Hotel is the suspected source of the Parafield cluster.
We are very concerned about surface transmission. We've read about this, we've seen it in other jurisdictions, but this is probably the first confirmed case that we've had in South Australia.
The original source has been traced back to an infected traveller who arrived here at the start of the month. A cleaner picked it up and passed it on to 2 security guards, but none displayed symptoms.
This is a very, very worrying situation. I'm not going to underestimate the concern that I've got about this, which is exactly why we put some restrictions in place here in our community.
Now more than a dozen members of the Women's Circle are sick. In response, all hotel staff will face weekly COVID tests. They've been spared until now, despite this August declaration that security guards would face regular surveillance.
But as part of an active surveillance program, you would expect us to sort of carry on a steady basis into the future.
But the issue is whether we've mandated it or not. And we have had it as a voluntary, as have other states.
Hotel quarantine posed massive problems in Victoria. An inquiry there recommended staff be limited to the one workplace, but that hasn't happened here. Staff at the Peppers were also working at the Mantra on Frome Street.
My understanding is that there had been some crossover of staff, and that's why we've listed the two sites.
The federal government is hopeful history won't repeat.
We're not out of the woods yet. There's more to be done, but we are in an extremely strong position, and I have to say South Australia's response is a model of early intervention.
Early intervention has been on the mind of shoppers, an outbreak of panic buying prompting stock limits at some supermarkets and more drastic messaging at others.
Everyone just needs to calm the farm.
Words the government is keen to echo.
And Stacey Lee joins us live now from the Adelaide Parklands train terminal in Keswick with an update on the GAN.
Well, Jess, the GAN hasn't arrived here just yet. We are expecting it to get here within the next half an hour or so, and there are 221 passengers on board. It was en route to Darwin when it was turned around at Alice Springs after the Territory government slammed its borders closed to people coming from South Australia. That's, of course, following the outbreak of that Parafield cluster. Some residents of the APY lands have also been left stranded too after the bus service, which usually ferries them between the lands and Alice Springs, was forced to stop operating. And it's been a bit of a confusing day for South Aussies around the country, around the rest of the country as well. In Queensland, people from Adelaide are being warned not to go to tomorrow night's State of Origin match, or they do face a fine for doing so. The ACT hasn't yet closed its borders to South Australians. It says it's monitoring the situation here closely, though, and anyone who does arrive at the airport from Adelaide and is displaying symptoms of COVID-19 is being tested on arrival. It's been a bit more confusing for South Aussies in Tasmania, though. 10 of them were escorted off a walking track and ordered into home isolation. The government there says it wants to monitor the situation here really closely over the next couple of days before they make a decision on whether or not to go back on their determination to send people into mandatory quarantine. Back home, the Adelaide City Council has just confirmed that the New Year's Eve fireworks will not be going ahead. The Lord Mayor says that decision was made because of the unpredictable nature of COVID-19 and for the potential for large gatherings to take place, so it was just too risky to go ahead with it this year. Meanwhile, for lots of South Australian businesses in the city, it's been a hard day. The latest restrictions came into place at midnight, and some of them don't know how long these latest measures will last.
Keeping fit during COVID hasn't been easy.
Just open for 20 seconds.
And with gyms forced to shut their doors overnight, fitness fanatics had no option but to go outside.
It was a shock. We were thinking maybe a square meterage rule for our gym, which we were going to be fine with. But when it was closed down, it was a quick transition.
No such transition for Jane Gretsch's dance centre. Normally buzzing with ballerinas on a Tuesday morning, today it was empty.
I don't know whether it was a roller coaster because that has an up. This was definitely all down. We didn't see it coming. We were definitely in shock.
Elite athletes not immune from the COVID chaos. Tonight's WNBL game in Queensland postponed as the Adelaide Lightning is forced into quarantine. A tough day too for the hospitality industry. Pubs, clubs and restaurants are now capped at 100 patrons as organisers scrap major events and festivals.
We will be open, but again, you know, with reduced capacities, it makes it very hard to make it economically viable.
The Unibar's future is already up in the air, and if restrictions don't lift soon, it may be shut down.
Pretty deflated, to be honest, pretty disappointed.
While small businesses in Port Adelaide are already noticing a drastic drop in turnover.
We're just confused. It's hard, yeah, but we always get through it. Last time we did it, and we'll do it this time as well.
Businesses providing personal care and beauty services, like this hairdresser, have had to start wearing masks as of today. South Australians have also been advised to wear a mask in situations where they can't socially distance, such as on public transport.
We have to do it just to protect ourselves and the people next to us.
COVID safe, just in case I don't want to spread.
Mask or no mask, the message from the government is loud and clear. Don't travel unless you have to. People who have chronic health conditions, who are in an older age category, I urge you to stay home as much as you possibly can at the moment. Staying home in a bid to stay the virus. Sarah Mullins, ABC News, Adelaide.